Hello, welcome to another installment of Number 9 Research. This is Patrick. I'm sitting here with Casey.
Hello, and on this episode we are continuing with Sara Ebberts of Minds Matter, an occupational therapist and soft tissue physiotherapist. Patrick, what will she be showing us today?
She'll be walking us through a session demonstration of soft tissue manipulation, intentional on relieving muscle tension that can lead to somatic migraines, often afflicting those with head injuries.
Associated somatic symptoms are more common in patients with chronic migraine and CDH.
CDH, or chronic daily headache, is defined as a pattern of persistent, unremitting, daily or near daily head pain. It's defined as lasting for more than 4 months, during which the person who is having these CDHs has at least 15 headaches a month, and the headaches themselves are lasting at least 4 hours per day.
Associated somatic symptoms are more common with frequent severe headaches and with associated anxiety or depression. Patients with episodic migraines have similar somatic prevalence. Somatic symptom disorder is diagnosed when a person has a significant focus on physical symptoms, such as pain, weakness, or shortness of breath, vertigo, dizziness, to a level that results in major distress and/or problems functioning.
So I'm putting a towel over his eyes to help with light sensitivity. 2 rolled up hand towels go under the neck, mid, so that the curve of the neck is natural. You want to put it in a place where you get that natural S curve in the neck. His occiput is able to fall back and relax. And I'm going to start with pressure into the upper traps. My thumbs and the heels of my hands. Just applying pressure. I'm working it in an alternating motion. I'm looking for those trigger points. And then applying pressure either with my thumb or with a tool if you need to. Breath and exhale. Now I'm going to come in with my hands in a C position and work the traps in sort of a milking motion where I'm squeezing and pulling gently, firmly but gently. My thumb is applying medium pressure on the attachment sites of the clavicle. And also the humerus and the attachment sites of the front of the scap. Top of the scap. Now I'm going to remove the towel, and I'm placing my hands along the occipital ridge, the attachment site, and applying pressure to again allow the neck to fall into the natural S curve while applying pressure at the attachment sites and applying protraction. The tight posterior neck muscles to release. Slight traction. We're applying upward pressure with my fingers. And I will hold this for as long as I need to in order to feel that release. Can apply some gentle cross-fiber friction. Do some gentle range of motion to stretch the levator. Turn it the other way. Stretch the left levator. Just applying some gentle traction. And I'm doing this just as I feel is necessary with no structure or routine in mind. Just looking for the right feel. Release. Those knots and those tight points in the fascia and the muscles just become more pliable, and you get used to how that feels. Even if it's a small release, you can just feel an increase in the pliability of the neck muscles. So you just learn by feel. Start out at the head of the table, and I usually start with some effleurage to kind of my client get used to my touch and start the relaxation process. And I do that a few times. I'm up here around the traps and the occiput, and then I start palpating with my fingers to look for those trigger points. And through the traps, upper traps, mid traps, lower traps, rhomboids, and working those trigger points, the knots that you feel. Sometimes you'll get feedback from your client as to, oh yes, you're on the right spot. Sometimes you find a trigger point and the pain is referred to another area, and that is perfectly normal and common as well. I will also, as I loosen up the superficial layers and I can start to get in a little bit deeper, I will come in and you can lift the scapula up. You can also have the person, if they're flexible enough, bring their arm back. We'll open up the scapula. You can see scapular ridge right here. Supporting the front of the shoulder, and then taking my thumb and pushing inward into the rhomboids and underneath the scapula. And what that looks like over here on this side. Supporting the shoulder. You can also put a towel under the arm if they can't bring their arm back this far. You can place towels under to add some support and give a release that way. And come in with my hand, pop that scapula up, and I'm pushing inward. to get that release. Sometimes the teres is tight, and you can come in here and get a release from the teres and where the latissimus dorsi attaches if it's really stuck. But getting some motion in that scapula will also help release the knots that are in the upper back in order for these muscles to not just relax, but to be able to contract properly and give the correct support for a more normal posture. This will help not only relieve headaches that go along with brain injuries that are often very, very common, but also kind of help relieve, mitigate that forward posture that is not just common because of screens, but also light sensitivity will cause people to curl inward. So by creating more support, less tension, and less pain, it makes that correction in posture much easier and creates relief from pain and tension headaches.
For me, I can take a lot for migraines or whatever this headache is that I get from stress. But you pushing on the areas of the back for what, 10 minutes? And the headache's gone. That's been for 3 days.
Oh.
That's kind of amazing.
Yeah.
And
Yeah,
no
it's
Advil.
amazing what